changed dramatically. I'm excited to say that we're just talking to Alana, Hunter, Justin, Miranda, and we're just talking about, we're going to be doing a little bit more lives. We're going to be doing a little bit more Q&As because we're also prepping for our TW subscription. It's called our TW Plus, where it's more of a private thing where we get to actually talk about some more detailed stuff. A lot of people ask me some questions, and you notice we put on stories both on Instagram and Facebook, and I know we're on Facebook right now, but said, what questions do you have? The responses were crazy, so we will be doing those on the private platform. Private platform allows me to talk about things that, no joke, would get us kicked off a platform. I would speak about them right now if I wouldn't get kicked off. But so that's why we just have our own platform and everything from there. It was kind of forced into it. Now remember, I'm also on my email right now. I'll cover up my email. If you take a look, I'm on my email. If you do have a private question that you just don't want to ask because it shows your name or your handle that way, please do me a favor. Email me at pflynn@thewellnessway.com. pflynn@thewellnessway.com. And once again, me, Dr. Bryce, Dr. Lucas, Dr. Devin, will have no problem responding. It might take us a little time because I can honestly tell you that we do get so many emails per day, and we try to get our doctors to respond to a question. Now, this happened the other day. Hunter and Alana, how many times do I tell people, if you see an office, please do not send me your labs. I will not comment on them. I will not look at them. I had somebody send me a lab, said, can you take a look at this? And they cut off like the provider. I'm like, oh, that's a telltale sign that you saw in our office. And like I said, be honest with me, young lady. Do you see one of my offices? She said, yes. And I said, I have a very strict policy because you're asking me, oh, I just want a second opinion. My second opinion is ask your first opinion because he's well trained, okay? He or she is well trained. So we are going to start with a little Q&A here. I'm going to go for just a short time, probably till 4:30. And so, Alana, Hunter, where are we starting?
Do you have any suggestions for oxalate dumping?
Okay, you remember, when you look at people that have kidney stones, some buildups, oxalates are very high in spinach and chocolate and other foods, and some people can't tolerate them. Some people do very well with them, some people can't tolerate them, so therefore they can build up when they mix with calcium, and that's why you'll see a lot of kidney stones are very calcium and oxalate based. So therefore, it's important to make sure that you have good kidney function. One thing that if you do have buildup, I really like dandelion root. If you look at dandelion root, it's a very good diuretic. It's also very good at causing the gallbladder to release, bile, and also the liver to shift through for some bile stasis. But the idea is this: if you really want to see that oxalate being dumped a little bit more, I would also take in a mixture. I would take about 10 ounces of water, about 2 tablespoons of apple cider vinegar, and what I do is I drink that on a regular basis, like maybe every couple hours I drink one of those, and then take dandelion root. You're gonna have a very high diuretic, and you'll be able to flush the system out. Now remember, when you drink that much water, you need mineral replacement, because when people drink a lot of water and don't add a lot of trace minerals to it, you can go mineral deficient. We want to make sure always putting minerals in. Obviously, having the best diet with a high mineral-based foods is always the best. So we can start there.
So Joy says, thanks to you, my daughter is off birth control. Exciting.
But let me say this. Who said that? What was her name?
Her name is Joy. She said, thanks to you, my daughter is off birth control. And then she did ask if there's an app or a way she can track so she doesn't get pregnant yet. She's in nursing school.
There's a lot of wonderful, just go on the App Store, and there's a lot of wonderful cyclic apps on there. They're all good. I've had several reach out to me to endorse them or be a part of them. But I know it's really funny. I said, listen, guys, if you have a good app, just tell me, and I look at it, and I think it's great. There's a bunch of them out there. And remember, there's a very narrow window to get pregnant. It's just a lot of women fluctuate in some of their, cyclic time. Someone will go from 31 to 28 to 30, and therefore sometimes it's a little harder to track, okay? But there's a short time period that you can't get pregnant. It's just know that, you know what I'm saying? And because I get very excited when people stop taking endocrine disruptors when it comes to their cyclic issues. There's other ways. So Joy, you brought a lot of joy.
Best way to get good fiber in my diet.
Okay, you want to have both soluble and insoluble fiber. I would say this. I am addicted to certain cruciferous, Brussels sprouts, arugula. I absolutely love sauerkraut. I'm sorry, I think people sometimes get sick of me saying it, but I love sauerkraut and liver. Now, liver is not a big fiber food that way, but if you really focus on, things like, Brussels sprouts and cauliflower and broccoli and I like to steam them a little bit to give a little bit of change in there. But then I'm such a big sauerkraut fan. I'm also a big fermented fan because fermentation is actually kind of pre-digestion it. There's nutrients that are produced in the consumption and formation and changes of fiber. And therefore, the more that we can do on a regular basis, and I personally don't deeply enough fiber. I know what the RDAs are for children and adults, and I can tell you right now, my kids go way beyond what the RDAs are, and that's why I don't have any bowel problems, and that's why, and also this though, because I know people say, well, doc, are you mainly vegan? No, I would tell you this, we dominate in meats. We dominate meats. I can honestly tell you, because when you look at the Flynn household, you look and go, what's our protein source first? No matter what the supper is, no matter what the food is, if you look at my daughters, they've been trained since they're little. What is your protein source first? Is it going to be, ground beef? Is it going to be salmon? Is it going to be, steak? Is it going to be another form of fish like cod or other ones? Is it going to be, a ribeye compared to like some sirloin? And therefore now build around that protein. And usually I'm always encouraging my daughters, and it's a kind of regular household, to move towards the cruciferous, because cruciferous also have specific CYP1A1 pathway inducers that allow for more estrogens to be regulated, and that's why I do like cruciferous. And that's what there's this. I want you to know that I take cycle so serious that even my 11-year-old, who will eventually probably get her cycle in the next 5 years, that when she does, because she's so loaded with sulforaphane and all the other, phytonutrients that come from cruciferous, that she's just going to have a better regulated cycle than the kids that are eating highly processed, ultra-processed foods.
Low albumin.
Yep. Sucrose, which is both glucose and fructose. Reduce that, because that does take a burden off your kidney and also a burden off your liver. Take dandelion root, be protective of both the kidney and the liver. And then you can go back.
Add.
The benefits. But I am concerned. I really am. I would like to see a little bit more. I'd be looking more at maybe hydration, magnesium or potassium C, some irritable bowel processes that need to be addressed. So I don't have any problem with you taking a poop after a coffee. I would just want to see that happen regardless if you do coffee or not.
Thoughts on dairy?
Okay, I think this one is going to, Hunter and Alana, check out the comments on this one, because I think it's going to drive a lot of people nuts, okay? I will tell you this. Christy, her life changed once I removed dairy from her life. It dramatically changed. And she grew up on a dairy farm. I can honestly tell you, I can't go a day, and I have patients that too, which is a fat soluble vitamin. In the whole world, it's one of the biggest things that has it. To break down lactose and other proteins within dairy, that it can cause anything from psychological to GI problems to everything that. Meeting today. And I was talking to Alana and Hunter today, because Alana, Hunter, Justin, Trinity, Miranda are all part of our, we call them their avatar. They create all the material. My start, my history, and that everything can't be so absolute because of goat cheese. Love it. Oh, me and Trini will sit there and just chew on a block of it, okay? I love sheep cheese. I actually do extremely well with cow dairy. I know children that if they had any form of dairy, the psychological consequence would be a breakdown. I mean, literally a mentally breakdown. So therefore, all these things put together, you can never look at and blanket everybody on any food. But I will tell you this personally, I am going to continue. And you guys know, I became a doc, not because of Chrissy's story. I became a doc because of my story. And I had an IgE response. So the most common, well-known allergen form is an IgE, just because it's mainly focused on when it comes to medical profession. DEGs. You understand? I will tell you right now, it's one most, digestible, nutrient, available proteins. Your body's going to reject it because it's in excess. Anything in excess of the body can be toxic. Now, toxic means it's not needed, so it's going to either push it through your bowel or puke it back up. No one really knows the upper limits of protein yet. No one does. But could you? I believe you can. Does anybody really have a definite number? No. I've seen a recent research article talk about a person they did 100 grams of protein in one sitting, and still there was some benefit. Did they get all the benefit compared to dividing out? I think it was more shown that they did it better if they divided it out. But there was good benefit, and they didn't seem to get harmed from it. So I believe you can have too much of anything. I think the only thing you can't have too much of is just me. It's just come on, we'll have a little fun. It's hump day. All right, what do we got, Lana?
What if I have a sensitivity to cruciferous? It makes me super bloated.
So Erin, my head journalist. Now she's not the only one. It's just that you guys have seen her on camera on Saturday mornings. You see her. She's our head person that puts all of our articles. Besides our work, she can't be a little bit. If people have a history of antibiotics, there is a oral, throat, stomach, small, large intestine, microbial disruption. There is. And therefore, all digestive processes can be affected. Many years ago. Just the GI doesn't seem to, the upper to lower GI just doesn't seem to digest things, and without some major gas and bloating done. So therefore, that's why people sometimes react to even the healthiest cruciferous on the planet. So once again, what have I always taught you guys? I'm never going to give you some blanket statement that this is all good, this is all bad, because I can show you people that smoke till they're 90 years old, eat crap, even overweight, and they're 90. And I can show you people that are fit at 45 and die of a heart attack. So now remember, people say, well, doc, you always talk about those are exceptions, not the rule. Yeah, but they still exist. So it does change some perspective on things.
Suggestions for removing inflammation from the body.
Okay, too much of a general statement, but let me do this. Usually when people can tell that they have systemic inflammation, they have some pain, bloating, gas, spinal pain, extremity pain, headaches, and therefore, no different than if you have a tonsil swollen, there's going to be some trigger to it. And therefore, there could be a deficiency of vitamin D, there could be microbials, there could be foods that are irritable to the system. If you do respond negatively to cruciferous, that can create some inflammation. Well, then don't eat it. If you don't have enough protein and you lack the regenerative aspect and you're going to be inflammatory consistently, you got to eat that. There could be a stool test that needs to be done because you might have some parasitology, some bacteria, some Other factors, viral panel, which you got to do a viral panel separately than a stool test, that are there. Heck, mental stress can be the major factor. Okay, this is tough, but you say, you will, because your muscles are going to need just by that, and you're going to see some weight loss just by cutting back on calories. Now be careful, because if you drop back too much with that way, because remember, you're asking me about how to lose weight a little bit quicker when you already have some good physical activity. Okay? No number one thing. There's no number one thing. I think that if we look at, okay, population-wise, let me try. Nope. I'm gonna retract my first statement. Scared when you guys don't get a lot of sleep. My daughters, ask them, sleep. Get to bed at the right time. Get enough of it into the body. Protein deficiencies that people are not getting, you can start really digging into those other things.
I'm 27.
Let's do this. If you think about this, things to where you can be satisfied, but then keep the calorie intake down, we're going to have a really good success at you losing weight significantly at a good pace. And so I want you to, and everybody say, Doc, you tell me to go carnivore. No. Because once you get that protein source, I want you to go to a cruciferous source that you do like. I'm telling you right now, this is me. I loved Brussels sprouts and bacon. Oh, so good, okay? Then I love steamed, so good, okay? Then I love steamed cauliflower. Then I love sauerkraut. Now remember, those may not appeal to you, you might have to find yours. But if you can focus on protein, number one, okay? That's by far. Understand how many factors contribute to weight gain. I want you to get a very good source of vitamin D3, K2. And I would like to have your blood work done first though, but at least you can start with maybe 2,000 IUs a day. I believe that's very deficient, but let's just say start small because you don't have the blood work done. And if you focus on those three things, and that's all you do for the next week, and you come back next Monday or next Wednesday to my live, I guarantee that you'll say, I lost some weight. Now, once again, but you have to find that satisfying protein that kind of fills you up, because you're gonna find out that chicken breast, that steak, that ground beef, that plant-based protein, which is not as mentally satisfying, if we can find that satiating food that says, hey, I'm good, do you know what I'm saying? Because I was asked a question in our video production before, what about sourdough? Well, guess what happens? Sourdough has some massive benefits, but man, you just can't eat just a little bit. You know what I'm saying? You just want to eat more. So we got to find the things that are satisfying. And therefore, the only supplementation I'd like to see you do is some form of vitamin D3, K2, movement, really focus on protein and add some cruciferous as some other side factor. And I can tell you right now, young man, you'll come back within five days by Monday, 7 days next week, and there will be progress.
I took an antibiotic for a tooth infection.
Yeah.
What should I do, or what could I do to rebalance my body?
Okay, if you ever take a antibiotic, I'd like to see supplement with a probiotic for a short time. But then you just get back to your fermented foods. I can honestly tell you, I don't ever take probiotic, because I can't tell you last time I ever took an antibiotic, probably as a kid. But the idea is this, but I'm consistently eating fermented foods. Fiber like crazy, which helps microbial regulation and microbial balance throughout the oral, the throat, the stomach, and small and large intestine, upper lower GI. So then supplement with a probiotic for a short time, and then really hit the fermented foods and really hit the fibers.
So there's some people asking how they can schedule an appointment with you or a doctor. Can you talk about that?
Okay, a couple things. Number one, make this very clear. I try to tell everybody this. I assist my doctors massively with patients all over the world every single day. I can honestly tell you, Dr. Kate sent me some labs here. Dr. Beth Cook sent me some labs. We have a phone call tomorrow tomorrow, and I just opened up the one from here. It's a Dutch test, a 4-year-old woman. It's great. I'm gonna go over. We're gonna go over this. I get to talk to my Green Bay docs. I'm here in Green Bay all the time. We converse. We do trains out like crazy. We do trains for all of our offices every single Tuesday. A lot of lab work, a lot of intense, a lot of case studies, guys, not a joke. We have millions of labs. We have millions. We don't have thousands. We have millions. Remember, as many doctors I have had for 25 years in all the offices, we do a lot of labs every single day. Okay. That being said, all the people are highly trained. Highly trained. They're going to give you some good info and good information. So when you go to the Wellness Way at findaclinic.com, so thewellnessway.com, and you go at the top right, there's a Find a Clinic. Man, like I said, Dr. Beth Cook, my other docs here in Green Bay, Appleton, everywhere. We get more offices every single month. I'm actually going to be flying out to Colorado with one of my wonderful doctors, Dr. Shannon Bundy. I got to speak out there. We got hundreds of people coming to my iStudy event out there. But her and I are partnering up with another doctor and having another office in Colorado. We'll be opening up in Esther Park soon. And that doctor's already trained now, will be highly trained when they see it. Now, I think it's Instagram. I don't think it's TikTok, is it?
Not TikTok. I think it's just Instagram.
If you're on Instagram right now, you can type in schedule, and one of my doctors will literally call you. They'll literally call you, free of charge, just to see what's going on, discover what's kind of happening that way. And let's say all of a sudden you're in Spring, Texas, like Dr. Beth Cook. You might talk to my one doc, but she'll probably try to get you to the closest office that we do have in that area. If for some reason you don't have one in your area, they can do just a phone consult with you. But the idea is this: they will absolutely be able to guide you to somebody that's going to help. And so if you're on Instagram, do me a favor, put schedule in the comments. If you're on TikTok or YouTube, please do me a favor, and just do me a favor. Say, I'm looking for a doc, and give me your city, and I will send this to one of my doctors as quickly as possible. pflynn@thewellnessway.com, and just say, hey, I'm looking for a little bit of help, and then and let me know where your city is, and I will send an email and connect and respond back to you personally. I already got several emails, and I got one from Michelle, I got one from Manny, I got one from Nancy, I got one from Dion, I got one from Michelle, I got one from Dana, so let's go. I'm getting your emails, I really am, and I will have us respond it. So if you do need a little bit of guidance, Instagram, put schedule. If you want me to help you find somebody, and or have a question, you can pflynn@thewellnessway.com. All right, guys. Holy, we went a little bit over. Well, Hunter, it seems like you got one important question there. He's chomping at the bit. What do you got for me, Hunter?
Do you have any postpartum guidelines for diet?
Yes. Okay. I want to say this very sincerely because female hormones have been my focus since I was in my early 20s, because of what my history with my wife. Understand that hormone production is always number one. What's happening with the pituitary, which is part of the brain, extension of the brain? What's happening with the response to the ovary, the adrenal, the adipose tissue, because adipose tissue acts like an endocrine gland by converting hormones, having some production. So therefore, it's very important to be able to have the responses that the hypothalamus and everything responds and releases from the pituitary. So I'm a very big fan of things like cod liver oil. Because why? We get some essential fatty acids, we get some vitamin D and vitamin A, which is essential for neurological function. I'm a very big fan of things like mucuna seed, which actually helps us with some dopamine production. Then I'm also a very big supporter of certain, vitamins and minerals and herbs that support the adrenals. And I would look at ashwagandha. There's also some very good iron in ashwagandha. A lot of people don't realize that from a plant source, ashwagandha has a very decent form of iron, which does a wonderful job of supporting the adrenals. It's known as an adaptogen. I've used it I've probably given hundreds of thousands of bottles of that out through my career. Then what happens is supporting the ovaries is very important. And that's where some of your fat soluble vitamins are very make sure that you have good digestive processes, but then making sure that you eat things that have fat soluble vitamins in, A, D, K, and E. That's why I'm a very big supporter of organ meats, because they do have a significant amount of fat soluble vitamins, especially liver. So you can, and if you don't want to eat liver, you can take liver capsules. On the flip side, I like to see things happen to where if you do end up taking some form of herb, I want to support things that are going to have, progesterone production. So I do like chaste tree. So those things right there will have just a benefit, even if you're breastfeeding, because once again, those things are supportive to the body. Why breastfeeding? Why your postpartum? Because if hormonal regulation isn't there, remember, ladies, physical and psychological consequences of hormone imbalances are a bad day. It's a bad day. You know what I'm saying? It's a really bad day. So if we can focus on those things, it'll do something and have a positive change. It's very difficult to want to test your hormones right after having a baby, even within 6 months, because, especially for breastfeeding, because there's just changes and those levels won't be within range. And so everything will look off because you're still breastfeeding or you're still postpartum. That's why it's important to wait for a good 6 to 8, maybe year, based on what you're doing, to actually get some accurate labs. So, Hunter, Alana, great day today. Great job. Lots of videos. Watch all the stuff that's coming out. Check out what's going on. Leadership and Longevity Conference. We have our subscriptions that's killing it out there. You can get a subscription and type in disagree so you can see behind the scenes. And Durham, is everything perfect behind the scenes? Nope. Is everything great behind the scenes? Yep. Are we making it better every single day? That's what we do. All right, guys. We'll see you guys on Monday.